Techniques and tips for preventing hair loss. Now, it's going to depend on the type of hair loss that you have as to whether or not you can prevent it. So let's talk about traction alopecia first. That is something that you cause yourself from either pulling your hair back too tight for too long, so tight ponytails, things like that. So we recommend, if you have to have your hair back for work, for example, just try and pull it back in different directions. So rather than up this way, you might pull it back this way or down in a low ponytail. So really down low is best, because if we're pulling up this way, this is where the traction starts, and back tight this way. So we want to try and avoid that as much as we can. But if you can't, as soon as you have a lunch break or you finish work in the car, just take it out to minimize it being back. And if you're tying it back at night time when you go to bed, just sort of do it low rather than up high. Male and female pattern hair loss, well, how do you avoid that? Firstly, it's being aware, is there any genetic thinning in your family? And the sooner that you treat this, the better that your results will be in terms of recovering and keeping that hair. Generally, for male and female pattern hair loss, it is going to be long-term use of medication or supplements, whichever way you choose to go. But it's not just a quick fix of taking a tablet and it's fixed. It's ongoing treatment for this. Very treatable, but it's just ongoing. So while you take medication, for example, you'll have hair. And then when you stop it, all that will happen is you will reverse back to where you were supposed to be. So it won't make it worse, it's just you reversing back to where you should have been if you never took that medication. So just be mindful and don't think forever if your dermatologist is recommending minoxidil, for example. Just think, well, I'll do it for now, and it gives you time to have a breath and keep your hair while you contemplate how long you want to do that for. Alopecia areata, this is something that's a little bit unpredictable. So, stress is often a contributing factor, but there can be other triggers besides stress. So that's not always an easy one to control. If you did have a patch of alopecia areata, or diffuse alopecia areata, we recommend that you see your dermatologist or trichologist fairly soon after noticing that you've got this diffuse hair loss or patch, so that they can recommend treatment options for you. There's some really good options available now in dermatology for alopecia areata, but also this is something generally, if we get you within the first 6 months, that can recover on its own without any medical intervention either. Something to not just let sit there and get some advice on from your specialist. Trichotillomania, this condition tends to be associated with anxiety, stress, depression. This is something, yes, that you're doing to yourself, but it's quite a complex type of hair conditioning in terms of resolving it and having you stopping pulling on your hair. But again, consult with your specialist dermatologist or your trichologist for this condition as well. So there are things out there to help you, but you have to work in with your specialist on that type of condition. Thank you for watching. If you have any questions, please leave a comment below. If you would like to make an appointment, please contact us at melbournetrichology.com.au.